In this video, I'll try and answer some of the common questions regards vitreous degeneration and vitreous floaters, also known as posterior vitreous detachment. As one ages, the gel that naturally sits within the vitreous cavity tends to degenerate and collapse. People sometimes notice this as floaters within their vision or occasionally flashes of light. Occasionally the gel actually pulls hard enough on the retina to make a hole or a retinal tear, and in the worst case scenario, this can progress to retinal detachment. Therefore, sudden onset of flashes and floaters within your vision is actually a relative emergency, and you should seek prompt help from either an optician or possibly an eye casualty department. In the vast majority of cases, the floaters tend to settle with time and don't actually interfere with the vision sufficiently to warrant any further surgical intervention. A few patients will have retinal tears and retinal detachments, which of course need to be treated surgically. This leaves a small proportion of patients who have persistent floaters interfering with their vision, often with driving or reading small print, and which persists beyond 6 months. These patients are often very frustrated by their symptoms and come to myself looking for help as to remove the vitreous floaters and try and improve the clarity of their vision. Although all surgical treatment does carry a small amount of risk, modern vitrectomy surgery does now offer a relatively low-risk procedure to remove vitreous floaters from vision. So here we have a cross-section of the eye, clear cornea at the front, focusing the light rays, iris behind, lens focusing the light through the vitreous jelly onto the retina. Vitrectomy surgery is carried out through 3 small holes on the white of the eye, entering just behind the lens and just in front of the retina. This is a so-called pars plana vitrectomy. Entering in this way through sutureless small incisions offers usually a rapid pain-free recovery, and certainly much improved over techniques that were available 15 to 20 years ago when we had much larger incisions to deal with post-operatively. Having gained access to the eye, the vitreous jelly is fairly easily removed, and in the majority of cases this will leave a healthy retina that requires no further work. Occasionally I will find a retinal tear or retinal detachment sitting behind the vitreous floaters, and in that scenario I would treat with either laser or freezing treatment and then introduce some form of intraocular tamponade, usually an intraocular gas, which would press on the retina and hold it in place post-operatively. Vast majority of patients have a rapid, pain-free recovery. Those who are over 50 years of age would usually develop cataract fairly soon after vitrectomy surgery, and of course this needs to be addressed by a separate procedure at a later date.